Chronic obstructive pulmonary disease, or COPD, is a group of lung diseases that make it hard to breathe. It includes conditions like emphysema and chronic bronchitis. These diseases cause airflow blockage and breathing-related problems. Over time, it gets harder and harder to get air in and out of your lungs. This can lead to symptoms like chronic cough, wheezing, and shortness of breath. Everyday activities, such as walking or climbing stairs, can become challenging. COPD is a serious condition, but it is treatable. Treatments can include medications, pulmonary rehabilitation, and lifestyle changes. Quitting smoking is the most important step you can take to slow the progression of the disease. With the right care, people with COPD can live full and active lives. Regular exercise and a healthy diet can also help manage symptoms and improve quality of life. Support from healthcare providers and loved ones is crucial. Imagine your lungs are like trees. The branches represent your airways, and the leaves represent the air sacs where oxygen is exchanged. Healthy lungs have strong branches or airways, and healthy leaves or air sacs. These parts work together seamlessly to help you breathe in oxygen and expel carbon dioxide. These parts work together to help you breathe. When you take a deep breath, your lungs expand, allowing air to flow in and out smoothly. With COPD, the branches become inflamed and clogged, and the leaves get damaged. This inflammation and damage make it difficult for air to move through the lungs, leading to the symptoms of COPD. The most common cause of COPD is smoking. The harmful chemicals in cigarette smoke damage the lungs over time. The longer you smoke and the more you smoke, the higher your risk of developing COPD. But COPD doesn't just happen to smokers. Other things can cause it too. Breathing in secondhand smoke, air pollution, or dust and fumes over a long period can also contribute to COPD. In rare cases, genetics can play a role. A deficiency in a protein called alpha-1 antitrypsin can lead to COPD even in people who have never smoked. There are two main types of COPD: emphysema and chronic bronchitis. Many people with COPD have both types. Emphysema damages the air sacs in your lungs. These tiny sacs are responsible for getting oxygen into your blood. When they're damaged, it becomes much harder to breathe, especially during physical activity. Chronic bronchitis is a long-term inflammation of the airways. This inflammation causes a buildup of mucus, which makes it difficult to breathe. People with chronic bronchitis often have a cough that produces phlegm. Section 4. Diagnosing COPD. How do doctors know? Diagnosing COPD starts with a visit to your doctor. During this visit, your doctor will take a detailed medical history and ask about your symptoms. They will want to know if you have a persistent cough, shortness of breath, or frequent respiratory infections. They'll ask about your medical history, including whether you smoke or have been exposed to lung irritants. This is crucial because smoking is the leading cause of COPD, and exposure to other lung irritants like dust, chemicals, and air pollution can also contribute to the disease. They will also listen to your lungs and may order tests to see how well you're breathing. Listening to your lungs can help the doctor detect abnormal sounds such as wheezing or crackling, which are common in COPD patients. The most common test is called spirometry. This test is essential for diagnosing COPD and involves blowing into a tube connected to a machine called a spirometer. This simple breathing test measures how much air you can breathe in and out and how quickly you can breathe. The results can help determine the severity of your condition and guide your treatment plan. Your doctor may also order a chest X-ray or CT scan to get a better look at your lungs. These imaging tests can reveal signs of COPD, such as enlarged lungs, air pockets, or other abnormalities. These imaging tests can help rule out other conditions and confirm the diagnosis of COPD. By combining the results of your medical history, physical examination, spirometry, and imaging tests, your doctor can make an accurate diagnosis and develop a personalized treatment plan to manage your COPD effectively. Section 5. Living with COPD Management Strategies. There's no cure for COPD, but there are ways to manage it and slow its progression. Effective management can significantly improve your quality of life and help you stay active. The most important step is to quit smoking if you haven't already. Smoking is the leading cause of COPD, and quitting can prevent further damage to your lungs. Quitting smoking is the single best thing you can do to protect your lungs. It may be challenging, but there are resources and support groups available to help you through the process. Your doctor may prescribe medications to help you breathe easier. These medications can help reduce symptoms and improve your ability to perform daily activities. These medications come in inhalers or pills and work by opening up your airways or reducing inflammation. It's important to follow your doctor's instructions and take your medications as prescribed. Pulmonary rehabilitation is another important part of COPD management. This program is designed to help you improve your lung function and overall fitness through supervised exercise and education. This program combines education, exercise, and breathing techniques to help you manage your symptoms and improve your quality of life. It can also provide you with the tools and knowledge to better understand your condition and take control of your health. Section 6. The nurse's role, COPD care and interventions. Nurses play a crucial role in the care of patients with COPD. They provide education about the disease, medications, and lifestyle modifications. Nurses also monitor patients for changes in their condition and provide oxygen therapy, breathing treatments, and other interventions as needed. They teach patients techniques to improve breathing, such as pursed lip breathing and diaphragmatic breathing, and help them develop an exercise plan that fits their abilities. Section 7. Key takeaways. Understanding COPD. COPD is a group of lung diseases that make breathing difficult. It's usually caused by smoking, but other factors like air pollution can contribute. While there's no cure, early diagnosis and management are essential. Quitting smoking, medications, and pulmonary rehabilitation can help manage symptoms and improve quality of life. Remember, knowledge is power. Understanding COPD empowers us to take control of our health and live life to the fullest.